Welcome to the bright side of aging. My name is Ike Engelbaum. I'm a pharmacist and the publisher of AmericanSeniorGazette.org. But I am not an expert like I have now on the line, Bianca Zuellig. Now, did you take special training to get involved with the Michigan Institute of Neurological Disorders, or once you get a physician assistant degree, you're pretty well good to go, so to speak, in almost any practice?
Yeah. I'm actually a nurse practitioner, which is, pretty similar to a physician's assistant. I was a nurse for about 6 years prior to this. And then I went back and got my master's in nursing and with a certification in adult geriatric primary care. So as long as I'm seeing patients 13 years and up, I can basically work in any specialty.
So you are a real smart person. I'm impressed that you are speaking to me, because it sounds like you are really very knowledgeable in the field. And I wondered, obviously there are various aspects of treating people. Why did you pick gerontology?
Like I said, the adult geriatric certification is nice because I can see patients 13 years and up. And, a lot of those patients have complex needs. So it's always kind of something new. In terms of working with the geriatric patients, I've had a couple of family members with, memory difficulties, and I've gotten to experience that firsthand. But it's nice to kind of be an advocate for your patient, if they're struggling to, manage needs or kind of understand what's going on. It's nice to be there for the patients and the families to kind of, give support and understanding, and also kind of empower them to manage their own health and work independently.
Mm-hmm. Well, I certainly have great respect for the whole field of neurology, and I cannot tell you how impressed I am with the cleverness of the organization name itself. Here you're dealing with neurological conditions, and the organization is called MIND, Michigan Institute for Neurological Disorders. That's fantastic from a marketing standpoint. So that is great. Where is MIND located?
We have 3 locations. There's one in Farmington Hills, there's one in Dearborn Heights, and then one in Roseville as well.
Well, that's certainly accessible. That's for darn sure. Is there a phone number that you'd like to get out if anyone is interested in the specific location? Do they have one number, or does each unit have its own phone number?
Each place has their own phone number, but the main number to the Farmington Hills location is 248-553-0010.
And do you mind repeating that? Go ahead.
248-553-0010.
Very good. So I wondered what the, as they say in the profession, I want to impress you with my vocabulary, protocol. What is the protocol, or what's the procedure if someone is interested that they themselves or have a friend that they want to help out, if they want to find out more about the organization? Do they have to be referred to by their primary physician, or can they just call?
They can usually just call unless they have a certain, insurance that requires a referral from their primary care doctor. If that's not the case, then they can just call. And then if you wanted to look at, the different services and the different clinics, you can always go on online.com as well.
So the simplest thing, I'm still a believer in just calling and setting up a time.
Sure.
On that initial evaluation and assessment, how much time should people set aside?
For the initial appointment with the physician?
All right, once they get in the office, I assume they probably take the blood pressure or what have you.
Sure, yeah. So once you come in, you'll get checked in, and then they'll bring you back to a room. They'll just take, basic history in terms of medical history, medications, and that type of thing, blood pressure. And then the doctor comes in and we'll do the initial assessment and formulate a plan. We usually schedule, all testing and everything before the patient leaves because a lot of the testing can actually be done here at Mind. So I'd say overall your appointment time would be about, 45 minutes to an hour.
I was told that Mind is sort of in a way almost like a one-stop shop. Can you tell us about Mind and what services they offer?
Sure. So we see obviously like a full range of neurologic injuries and disorders of the brain, spine, and then also the nervous system. And like you said, we really pride ourselves on being a one-stop shop for, not only the diagnosis, but the treatment and the management of everything that's going on. We have a lot of different clinics. We have the Alzheimer's Disease and Memory Center. In addition, we have a headache and facial pain clinic. We have a multiple sclerosis center, a pain management center, and they can do, interventions like steroid injections. We have a Parkinson's and movement disorder center. And then in regards to testing, if you need any imaging like MRIs or EEGs for seizure patients or EMGs, those can all be done here at Mind, which is really nice. And then we also have an infusion center as well. So if patients need, MS, multiple sclerosis medication infusions, we can do that here. If they need, headache cocktails to get rid of the bad headaches, we can do that here. We're infusing the new Alzheimer's medication. So in general, anyone with a neurologic problem can be seen here and get worked up here, complete all the testing here. And it's really nice that they can, do the testing and then usually see a physician assistant or the physician that same day to go over testing results.
Well, I'll tell you, as a healthcare provider, I cannot stress how terrific an idea it is to have patients really not have to run all over the place. We refer you to this place or other. Just the peace of mind to know that, hey, in that building, I'm able to really get a full diagnosis of my condition. And, of course, unfortunately, almost everybody that is listening to the program has been affected by a member who may have the symptoms of Alzheimer's. And I understand there's a new drug that has come out that you're right at the forefront in using it. Can you tell us about that?
Sure. It's called Aduhelm. It has been approved for treatment of Alzheimer's disease. It's the first medication that kind of works to remove those plaques in the brain, which is a hallmark, basically, of the disease, which hopefully will, lead to a reduction in that decrease in your memory. Mine was the first facility to infuse the medication over the summer in the country, which is really exciting. And a lot of patients have been interested in the medication. It's recommended for mild to moderate cases, and it does require a workup in terms of like MRI and blood work. And then it's kind of a case-by-case situation in regards to if your insurance will approve it. But we obviously will work with the insurance company or work with the drug company to try to get it approved for the patients.
Mm-hmm. Now, I've heard some controversial discussion about the drug. What do you think about it? Is it effective?
Yeah, I mean, we're really excited to be infusing it because this is, something that, I mean, prior to this, the medications that we use kind of just preserve the function that people have left. So if this can actually, improve things, that's really exciting for our patients. And then, I mean, in terms of the controversial things, it's been controversial in terms of the data really slowing the cognitive decline, and then, insurance can be difficult to get it approved. But I think the biggest thing is just coming in to see if you're a candidate for it and then kind of going from there. But so far, people are tolerating it well, and it's pretty exciting to have something new.
Wow, well, that's a real feather in your cap, and maybe it's a couple of feathers, I don't know, but it sounds
right.
It sounds really exciting, and there's always the controversy about, as I mentioned before, about memory loss and all. Do you have any thoughts in regards to knowing what's dementia or just normal memory loss or Alzheimer's, or any thoughts that you have along those lines?
Sure. Well, dementia is kind of an umbrella term, right? Mm-hmm. So it's associated with any decline in memory, but it also affects reasoning and other thinking skills. And there's actually many different types of dementia, and Alzheimer's disease is the most common type of dementia. Dementia is not a normal part of aging because there's actually damage to the cells that affect the ability to communicate. And then it can also affect behaviors and feelings and that type of thing. Alzheimer's disease, is a type of dementia. It's classified by those two abnormal structures in the brain, the plaques and the tangles, which are like the prime suspects for, killing those nerve cells. So the most common symptoms of Alzheimer's disease is, the most common one is learning new information because the disease typically goes after that part of the brain first. And then eventually it'll progress to things like speaking difficulties or maybe behavior changes, disorientation, confusion, those types of things. So it gets progressively worse. In terms of just normal aging, I would classify that more as, like memory difficulties here and there. It's not progressing. It's not consistent. But, if it is consistent, I do recommend you get it checked out and worked up just to make sure it's not something we can improve or fix.
Now, this may be too open-ended a question, but who do you feel should come to mind?
Well, in terms of, anyone with a neurologic disorder or problem should definitely come. In terms of memory difficulties, I would say the sooner the better. If you notice any changes in family or like friends or close people to you regarding changes in memory or, behavior or anything like that, they should really be addressed because sometimes it's hard for a patient to really identify what they're not remembering. So the sooner that you can come in and get a workup done, and we can kind of manage what's going on.
Now, if someone comes in, I'm reminded of the line where the patient comes into the doctor's office, and the first question the doctor asks the patient, he says, "So how are you feeling? How are you doing?" He says, "Doc, that's why I'm here. How am I doing?" So,
right.
So if someone comes in just to get the checkup or because they're concerned about like you described some of the symptoms, does any insurance company cover that type of a visit, or is it all cash?
If they're coming in for memory difficulties or like a certain complaint?
Right. Are the services covered by, are any of the services covered by insurance?
Yes, they usually are covered by insurance. But if you're worried about that, I would just, when you're making your appointment, just talk to the representative over the phone regarding, what insurance you have and any questions you have regarding that. They can direct you in the right location.
Mm. So if they call, obviously whoever's taking the call would ask what insurance coverage they have, so the patient would know before they visit the office whether their insurance indeed covers it. Is that correct?
Yes. Mm-hmm.
And the phone number, if you don't mind repeating twice, so people have a chance to write it down, go ahead.
Sure. 248-553-0010. Again, it's 248-553-0010.
Well, that's very good. I always like to promote our toll-free number because I give it out all the time, and our toll-free number is 888-489-8980, and I can put you in touch, and it's been a real privilege to talk to a physician assistant by the name of Bianca Zuellig. You could go into movies or something with that type of think about it, okay?
Right, a side job. Yeah.
Check it out at Mind. It's been a delight to have you on. Right now I got to take a brief break, and we'll talk to you soon again, I'm sure. Have a good one.
Okay, take care. Thanks for having me.
Right. Bye.